SMP Senior Medicare Patrol podcast, Sip and Learn with SMP. Thank you for joining us today. I am Janetta with Senior Medicare Patrol. I am the Community Outreach Specialist for the Mississippi area. We also cover the state of Georgia. So today, our topic for today is going to be Medicare pharmacy prescription drug fraud. We are going to discuss what to look out for and how we can prevent it. And of course, as always, we'll give you a little bit of information about the SMP program.
And I'm Brenda. I'm the Community Outreach Specialist here in Louisiana. But before we get started today, I must say that this project is supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington, D.C. SMP is sponsored in Georgia, Louisiana, and Mississippi by AdviseWell, Inc. So everyone grab your favorite drink and sip and learn with SMP today. Well, we're going to begin now, and I'm going to ask Janetta, what is Medicare pharmacy prescription drug fraud? And give us some examples of pharmacy and prescription drug fraud, please.
Thank you, Brenda. Sure. Well, there are many types of prescription drug schemes, but pharmacy drug primarily occurs when Medicare is billed for a medication that was not received, or when a beneficiary is intentionally given a different prescription drug than prescribed. So some examples of that would be billing for Medicare for prescription drugs that were never picked up, delivered, or even prescribed. Billing for prescriptions that were prescribed by a healthcare provider you've never seen, or billing for amounts beyond the quantity you were prescribed. Also, billing for a different prescription drug, often a more expensive drug than the one you were originally prescribed, or issuing you a drug that is not approved by the U.S. Food and Drug Administration. Another example would be a pharmacy that intentionally provides less medication than prescribed, or issues expired drugs. A pharmacy that provides and bills for an expensive compound medication, including topical pain creams, when a traditional or less expensive prescription was ordered by your physician. Also, a company offering you free or discounted drugs, prescription drugs, without a treating physician's order, and then bills Medicare. A pharmacy that is offering gift cards or other compensation so that you will switch your prescriptions over to a specific pharmacy. Another example would be a pharmacy that automatically refills a prescription you no longer need. Or if you don't pick up the prescription, but the pharmacy still bills Medicare. And the last example I have would be an individual offering to pay you for the use of your Medicare number to bill for prescription drugs, or offering you cash or other compensation to pick up your prescription on your behalf. Now, Brenda, what can you do, or what can we do to stop pharmacy drug fraud?
Okay, well, you gave us a lot of examples of possible schemes or fraud schemes when it comes to prescription drug fraud and pharmacy drug fraud. So in order to stop it, we can be sure that our doctors have assessed our conditions before prescribing any medication. You should make sure that a doctor has assessed your condition. Also, don't give out your Medicare number or personal information to unknown individuals requesting it for prescription services. Be suspicious of all unsolicited calls and offers for free or discount prescription drugs. Always, always read your Medicare summary notices known as MSNs, or explanation of benefits known as EOBs, to watch for the names of unknown providers and billing of prescriptions and other services that you did not receive. If you notice a charge to your Medicare drug plan for prescriptions you did not receive, or for different drugs from the ones that you were prescribed,
Mhm.
you have to report your concerns about possible fraud, errors, or abuse to us, SMP, Senior Medicare Patrol. And our number is 1-877-272-8720. Remember, SMP, what our mission is to empower you, your family, and caretakers so you don't become victims of Medicare fraud and healthcare scams. Okay, so it's important that you do open your EOBs and MSNs, explanation of benefits, and Medicare summary notices to check every time you get one to make sure that everything there is correct. And if not, you give us a call.
Yes.
So Janetta, tell us about pharmacy prescription drug fraud identity theft.
Sure. Be especially wary if someone requests your Medicare number or your driver's license to evaluate your prescription history. This could be at a health fair, senior center, an assisted living facility. It could be a mall, a farmer's market. Also, there are home shows, parking lots outside of the retail store or the pharmacy, or a privately sponsored wellness event. You have to be aware.
Yeah.
These venues are high risk for medical identity theft. So be careful. You know the information, and if someone walks up to you and asks you for personal information like that at any facility or venue, be wary. Medical identity theft occurs when someone steals or uses your Medicare number to submit fraudulent claims to Medicare without your authorization. Medical identity theft may disrupt your medical care and can result in financial harm. Be very careful because you don't want your information out there or your information compromised. So Brenda, tell us, how are these fraudsters benefiting from the errors, and how do you contact Senior Medicare Patrol?
Okay, well, criminals ranging from health providers to drug trafficking organizations continue to commit prescription drug fraud because it's very, very profitable. Unfortunately, there's a strong illegal market for prescription drugs, including controlled drugs such as opioids and expensive prescriptions, autoimmune medications. If you have questions or concerns, you can contact Senior Medicare Patrol by calling our toll-free number 877-272-8720, Monday through Friday from 8:30 in the morning to 5 in the afternoon, Central Time. We also have a website that you can visit. It's www.stopmedicarefraud.org. You can contact SMP National Resource Center at 877-808-2468 if you don't live in Georgia, Mississippi, or Louisiana. Every state has their own SMP organization that covers that particular state. So you can call the Resource Center and they will direct you to the correct SMP program for your state. We cover Louisiana, Mississippi, and Georgia. Our number is 877-272-8720.
Yes.
You can also go to the website, smpresource.org, and they will connect you, like I said, to your national SMP hotline for your state's program. Okay. And always remember, the tip that we always start off our presentations with pretty much is never ever give out your Medicare number to someone you don't know or trust.
Right.
So Janetta,
Mhm.
what are our prevention keys? We have 3 of them. So can you share that with us?
Absolutely. The 3 keys to protect yourself from fraud and scams. The first one is protect. Treat your Medicare card and Social Security number like a debit or a credit card. Don't carry it with you unless you need it. Don't provide your Medicare number to individuals that are not authorized medical professionals. Remember, Medicare will not call to ask for your Medicare number. The second one is detect. Keep track of your visits to the doctor, clinic, hospital, or pharmacy, and compare those visits with your Medicare summary notice or your explanation of benefits. Review information for potential errors or abuse. You want to look for things like double billing, charges for services that were not received, and or services not ordered by your doctor. And last but not least is report. If you suspect that you may have been a victim of Medicare fraud, report it immediately. Don't wait. Contact your senior Medicare patrol, SMP, for assistance with Medicare scams, waste, or abuse. Remember, reporting any possible errors or fraud helps to save your benefits and protects others from becoming a victim. So again, you can call our toll-free number at 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. We also have a website, www.stopmedicarefraud.org, or reach out to us on our social media platforms, which are Facebook, and we also are on YouTube. Got a lot of social media going on.
Yes, we do. And you can't forget the podcasts. We are on
And the
podcast
podcast.
platforms too. Yes.
Yes.
Okay, so that was an overview of pharmacy prescription drug fraud. We hope you enjoyed the topic today. Like I said just now, we also have other topics that we've already recorded podcasts on that you can go and do. You can find them on any of your favorite platforms by just putting in Sip and Learn with SMP. We have about 10 or 11 podcasts on there already that you can go and listen to and learn more about what it is that we do and how you can protect yourself from becoming a victim of healthcare fraud and Medicare scams. We want to also let you know that if you've listened to this podcast today, you can call in and request your free health track journal. You can call 877-272-8720. Let them know that you listened to our podcast, Sip and Learn with SMP, and that you would like your free healthcare track journal. So they will send that to you just for listening and sharing information that you might have learned today with your friends and on social media too. So Thank you very much for tuning in. Hope you enjoyed that favorite beverage while you were sipping and learning. We really enjoy putting these podcasts together for you because we want you to learn as much as you can so you can protect yourself from healthcare fraud.
Yes, thank you for tuning in. We hope you enjoyed it and hope you can join us again for the next episode. And for Sip and Learn with SMP. Thanks again. Bye, Brenda.
Thank you. Bye, Janetta.